photo with the hats.
Mm-hmm. Hey everyone, welcome. My name is Susana Craig, and I am here. Have the honor to have with us Dr. Sophia Yen, CEO and co-founder of Pandia Health. And what do we do, you say? Well, we deliver birth control to your house or to your mailbox. As long as you have internet and a mailbox, we got you. But more than that, we also know how hard it is to go ahead and get an online doctor consult, especially during this time that of COVID and us not wanting to risk. We also offer online doctor consultations for a simple $20. You get to talk to a expert birth control doctor, such as Dr. Yen. Anyway, today we're here to talk about something that's near and dear to Dr. Yen's heart and to a whole bunch of other people that I know, and that is how do I skip my period? Because really, who enjoys bleeding every month? So Dr. Yen, how do I learn to skip my period, or how do I do it?
Yeah. So check out our blog, pandiahealth.com/periods optional. And then you can also look for hashtag periods optional because we've thrown that out into the world. And at the bottom of that page, you'll see my TEDx talk on the science and safety of having fewer periods. And so the background is that in the old days, we would have our first period at when we were 16, and now we're having our first period at 12. We would have 7 to 8 periods a year. Now we're having 13. We would have 8 babies, not recommending that, but we would be bleeding far less frequently than we are now. And we would be breastfeeding for 12 to 18 months, and we're only breastfeeding for 0, 3, or 6 months. So the natural state is 100 periods, and we're having 350 to 400 periods, 3.5 to 4 times the amount of periods that we should be having.
And think about the landfills. That's so crazy.
Yes, we use 10,000 to 13,000 menstrual products in our lifetimes, and we could cut that down to a third. So you can save money, and then you could decrease your risk of cancer. So how do you do it was your question. So let me get there. And the way you can do it is with any hormonal contraception. So you could use the IUD with hormone, the implant, the shot. What we can offer you here at Pandia Health is the birth control pill, patch, or ring. And the way you do it is the way the pill, patch, ring works is they keep your hormone up for 3 weeks. Let's go this way. And then the last week, if you don't take the pills, or if you take the sugar pill, or I call it the bleeding week pill, then by day 2 or 3 on that, then you don't have any hormones. It's out of your body. The drop in hormone causes you to bleed. However, if you just keep going and only taking active pills, then you're fine. The one caveat is if you're on the patch, you can only do this for 12 weeks. After 12 weeks, the estrogen builds up, and then you're at risk of a stroke, a heart attack, just blood clots.
We don't want that.
We don't want that. So on the patch, you can go for 12 weeks, and then on the 13th week, you have to stop and take a break for a week to rinse out the hormones from your body. But on the pill and the ring, the hormone stays flat. It's not growing. Whereas on the patch, it's slowly accumulating. And so on the patch, only 12 weeks. On the pill or the ring, you could go years.
Yeah. So the cool thing about it is not only does it enable you to stop bleeding, but also keeps your hormones at an even level. So, you know, you don't have somebody asking you the crazy question like, are you on your period? Which is not a good question to ask.
Exactly.
You know.
And it's also good for depression because you don't want hormones up and down, up and down, up and down. Good for diabetes because diabetes is all about smooth. Good for people who have seizures. And then for those people, they're like, what do I do? I have PMS or I have PMDD. Well, if we get rid of menstruation, then you don't have premenstrual syndrome. You don't have menstrual dysphoric disorder, you know. So no menstruation, no PMS. No menstruation, no PMDD. And I used to get a zit every single month around my period. I forget if it was after, during, or whatever, but that's how I knew my period was coming or was about or after. And after I went on the birth control pill, none of this cycling. So none of this once a month zit. Also,
it's this great hormonal pill that not only helps you stop bleeding, but helps you in other wonderful things. That's awesome. So we know that So is it true then, inquiries might want to know, because is it true that the moment I start taking birth control, I just skip those 7 days and then I stop for everyone, or will it take longer for some other people?
So it depends on each person with a uterus. Some women are every 28 days and they have crazy strong hormones. Some women are every 28 days, they don't have so strong hormones. Some ladies are 30, 35 days. Some women are 90 days. Those women have
Gotta find those people.
those women have polycystic ovarian syndrome, which
Okay,
affects
sorry.
1 in 10 women, which is very common. And so for that 90-day woman, very easy to turn her off. For the 35-day woman, probably doable. I'm that person. And then the 28-day lady with very strong hormones that drives everybody to her 28 days might be a little harder. And then every 28-day woman who's not so strong and doesn't affect those around her, probably doable. And so what I've seen is the 90-day lady, bam, we can go immediately to no periods. As long as you take your medicine, you won't have periods. For the 30, 35 day, the first time I tried it, I had breakthrough bleeding at 3 months. And then I got out to 6 months. And then I got out to 9 months. And then I was home free. For the 28-day lady, may make it to 3 months and may only be able to make it every 3 months. Or may make it to 1 month, have some breakthrough bleeding, go to 2, go to 3. I think we can eventually get that 28-day lady to 3, but there are always exceptions. And know that there are 40 different pills. So we can at least play with 2 different levels of estrogen and 7 to 8 different progesterones that we can try. And each of those have different effects. Some of them stronger than the others. And we just have to sometimes go to the strongest one, but doesn't have necessarily more side effects, that strongest one.
So that's the important thing, is that as a patient to advocate for yourself and talk to your doctor. You know, your doctor can't read your mind. So talk to your doctor, say, hey, this is working, this is not working. And then we have 40 different types, or the doctor has 40. I'm not a doctor, but I'm just repeating what you're saying. That's awesome. I'm so excited. I always thought that it was like one of those, I always thought it was a story. I didn't realize it was true, that if you're around other women, that in fact your period can kind of schedule according to them. I didn't realize how true that was. So that's interesting to know.
Yeah, no, I think I've looked at the research, and there's been like 2 papers on the situation, and they found that there was no correlation. But I think that the studies weren't designed properly, because I have personally experienced it twice. And as an MIT scientist professor, that is the only explanation, is this 28-day lady in my room. And then the second time I was at an accelerator, and I'm a woman who has no menstruating people in my household. I have 2 daughters at the time that were under the age of 12. So they were not affecting my cycles. And then right before my pitch, I got my period, and I was like, I'm a doctor. I'm taking my medicine. What the hell? There's no way I should be bleeding. And I don't want to bleed on my pitch day. And then the 2 women next to me, 23-year-old, very hormonal women, are like, ha, I got it too. And I was like, damn you, very hormonal, healthy, crazy, fertile girls. Like, you infected me. And so if you're trying to get there, watch out who your roommates are. Because if you're in a dorm room and you're on the pill, but 2 other people are not, they could mess you up. And
no worries now, because everybody's home. But I have 3 daughters, and I could tell you that they all sync up, which is crazy. All right, so here's the question. So you're skipping your period, and then all of a sudden your period comes, you start spotting. What do you do then?
Yeah. So in the old days, we'd be like, suck it up, just barrel through. But luckily, we have research. And so we had one group, suck it up, barrel through. Then we had the other group stop their medicines for 5 days, drop the hormones, clean out the uterus, reset the clock, and then do it again. And as I alluded to before, some people make it out to 3 months, some people make it out to 6 months, some people make it out to 9, some just go immediately scot-free. So what we recommend is stop the active pills for 5 days. During that time, the hormones will drop. You will have a bleed. It will clean out the uterus, and I have a uterus. Clean out the uterus so that it is empty, and then you can build again on a fresh plate. And so that also kind of goes to, when should you start your birth control pills? And we usually recommend on the last day of your period, if you don't need it right away for birth control, if you can wait. Because rather than start on an unknown level of uterus, I don't know where your uterus is, I'd rather it cleaned out and we build on a fresh slate, a fresh palette.
Okay, so just because I don't know about this, so you have a pack, and like I have this pack here,
Great.
and I'm gonna start taking my medication, and then like on the second week, I
Yeah.
start bleeding. Do I start a whole new pack, or do I
So,
keep on taking the rest of the medication?
so the stopping part, if you need to be protected from a pregnancy, you at least need to have taken 3 weeks in a row prior to that of active pills. So if you're
Okay.
on your second week of your second pack,
Okay.
that's fine. But if you're in the second week of your first pack, if you stop it, then you are at risk for pregnancy. Make sure you use some backup birth control, etc. But if you're on the second week of your second pack and you have some breakthrough bleeding, just stop and then keep going. So at Pandia Health, we always prescribe you the monophasic, unless you came in on triphasic or unless you requested the triphasic. There's really no reason to be on triphasic, which means out of those 4 weeks, each week is a different color. And so if your pills are different colors, different weeks, and things get a little complicated, but you could stop and then you could start again. It's all arbitrary anyway.
Okay.
But if you're on all the same color, they're all the same. So where you stop, just keep going.
Okay, good. But not with the
Triphasic.
ring. What happens with the ring?
So the ring has 35 days worth of medication in it. If you get breakthrough bleeding on your second week of it, I guess you could refrigerate it and use it again, but I say just start a new one.
Just start a new ring. Okay, cool. Now, when you're planning to skip your period, is it important to tell your doctor that you're planning to skip your period?
You absolutely need to tell your doctor unless you're on the ring, because the ring has 35 days and they're not going to give you any more rings. But if you are skipping your period on the pill, you're going to use up more pills. If you are skipping your period on the patch, you're going to be using more patches. So the ring specifically, if you aren't skipping, 13 packs a year. If you are skipping all of them, 17 packs a year. If some women, they like to have it every 3 months. I don't know why, but if you like it, then not as many as 17 packs a year, maybe 16 or 15. I haven't calculated the math, but I could calculate it for you. But you're going to need more packs if you're skipping, and your doctor has to write it that way. Otherwise, the insurance won't cover it. So if you want to skip, tell your doctor to write skip placebo and give you 17 packs a year. Otherwise, the insurance will say no. And then the other thing is you want them to add a diagnosis to justify it. So my diagnosis that I put is dysmenorrhea. Dys meaning don't like, menorrhea meaning blood. And so if you're asking to skip it, I don't like blood. And my thing is, if a dude had to bleed 1 week out of 4, this would have been highly out there.
Right.
And it's just we as women have been sucking it up, and we should stop sucking
Well, that's
it
what
up.
we were taught, right? It's not like we wanted to. It's just like when I was growing up, I didn't know that there was an option. I mean, even now, I still run into people who say, well, no, you have to have your period because you have to clean out your body. If you don't clean out your body, you're at higher risk of all different types of cancers.
And that's not true. So what we want to get across today is that if you aren't on medication, yes, you should have a bleed every single month, or the doctor needs to figure out why. You could have polycystic ovarian syndrome. You could have anorexia. You could have a thyroid problem. You could have a cancer in your head. And the cancer they may be alluding to when you're not on medication is endometrial cancer. So that's, again, the lining of the uterus is growing. And that's what happens with polycystic ovarian syndrome if you don't treat them. Is their lining grow, and then you risk cancer. Yeah. But if you throw some progesterone at people who have polycystic ovarian syndrome, then it just sits like this. And that's what happens when you're on the pill to patch the ring. The lining just sits like this. It doesn't grow uncontrollably, risking cancer. There is a risk of cancer from the estrogen, but I want people to take it in perspective. The risk of cancer with the estrogen is an increase of 13 cases per 200,000 women. However, the perspective, if you drink 3 to 5 glasses of alcohol a week, you increase your risk of breast cancer by 22 per 200,000. And so if you cut that in half, if you just drink 1.5 to 2.5 alcoholic drinks a week, I don't think that's unreasonable. You increase your risk by 12.5, right?
Wow.
So that is similar to the 13 of the breast cancer. So
okay. Thank you for putting that in perspective. Yeah, that's really good. Okay, so then the other question that we get is, how long is it too long for breakthrough bleeding?
If you break through like an entire day, then it's time to come off. I know when I get breakthrough bleeding, I'm like, oh, can I just take a pill and hold it off? And again, it might be different. Different women are different. When I have one breakthrough day and I try to stop it, and or not, if I don't, and I just try to take a pill and be like, let's just not, I'm sorry,
I'm ignoring it.
Please don't do this. And it just wants to come. But I'm a more bleedy kind of person. So maybe if you're a less bleedy kind of person, you could just try to barrel through. But if you have breakthrough bleeding 3 days in a row, game's up, chica. Time to stop for 5 days, clean it out, have the stupid, horrific bleed. And on day 6, whether or not you're still bleeding, restart the active pills, because that will stop the bleeding.
Okay, so whether or not you're still bleeding, so you're not
on day 6.
On day 6.
No, do not wait. On days after 5 days off the medicine, restart active pills on day 6. Days.
Okay, cool. All right. I don't, I'm menopausal, so for everyone else.
But you are a mother and an aunt and just a resource to your community.
Apparently, I'm a very cool aunt. Anywho,
awesome.
So let's see if I asked all the questions that my boss asked me to ask. So Angela, can I get my period while I'm taking active birth control? We answered that one. What happens when I get my period in the middle of my birth control pack? We answered that. We know that if you're not taking what is that pill that
tricycline or trilomarsia or trinesia? There's like 10 of them.
Right. So you could just continue going on. You don't have to start a new pack. But if you're on the ring, most likely you will have to start a new ring. What about the patch? You will have to start a new patch because you're going to rip off that baby. Okay. Yeah. Why? Oh, that wasn't a good analogy, but you know what I mean. Why am I experiencing? Okay. And then some of the reasons why you may be experiencing bleeding while you're on the pill.
We didn't mention that one.
Yeah.
So we did it in Spanish and we'll do it in English. So why are you having breakthrough bleeding on your pill? The number one is you didn't take it at the same time every day. So if you're crossing time zones, right, and you're taking it right before you go to bed, it's going to be off by 3 hours, 8 hours, however far you traveled. So you can slowly move it by 2 or 3 hours a day, or as long as you're taking one pill every 24 hours. So don't move it out. You can always move it closer, but don't move it farther. Any sense as you're doing time travel. Time travel. The other one is an over-the-counter medication. So Sudafed, pseudoephedrine, cold medicines with pseudoephedrine in it can oftentimes rev up your liver and eat the hormones. And so the hormones aren't working as well. And so that's why you have breakthrough bleeding. So when patients come to us and they're like, breakthrough bleeding, are you taking any over-the-counter meds? Did you start an ADHD med? Did you start any other new meds? Because seizure meds and ADHD meds can also rev up your liver to eat up the hormones, and then you get breakthrough bleeding. And the breakthrough bleeding is a sign you are not protected against pregnancy. So that's the concern. If you're just going continuous and you have breakthrough bleeding, you're not at risk for pregnancy because you've been taking the medication. But if you get breakthrough bleeding, from other reasons, then
I remember one other one.
Yes.
One.
Go for it.
Let's say you get a new roommate.
Oh, yes. So this is the one that hit me, that, dawned on me, that if you get a new roommate, like you're coming from a home with your menopausal mother and you're heading off to college, and then you're taking your meds, you were fine on Mirena, you were fine on taking your pill or patch or ring, and all of a sudden you get trip, and you're like, what? And the roommate's like, I have mine too. It's the roommate. And so it may be 3 roommates overpowering you. It may be 1 roommate. If you're also starting a new job. So my chiropractor is magic. Everybody that hangs around her cycles to her 28 days. So she was the Mirena example. The receptionist was Mirena, and the chiropractor every 28 days. And the Mirena woman had not had any bleeding, but now introduce the chiropractor and she bleeds. On the flip side, if you're trying to get pregnant, hang with these 28-day ladies that cycle you with them, and they will help you cycle. So.
Wow. Well, that's cool. Well, I think we've answered all the questions, Dr. Yen. I mean, other than the fact that if you want a birth control expert to write a prescription for you that's appropriate, and one that a company that is there with you, that helps you advocate for yourself by offering all this information. Consider Pandia Health. We're a great group of women and men. We have men allies. And now if you just use the code TRENDING, you get $5 off an online doctor consult. And that's a deal. I mean, when you get an expert, a research expert and a doctor, expert like Dr. Yen and the rest of our doctors, sign on. And also know that if you already have a prescription, don't worry about it. Just transfer it over. What we mean by transfer is simply contact us, tell us where that prescription is, and we will take care of it for you. And no insurance, no problem. We have awesome affordable prices, and we work with you and ship how many ever you need. And we accept most insurances, including here in California. Because, oh wait, I forgot the markets that we offer online doctor consultations. I'll try to do it in alphabetical order: Arizona, California, Florida, Texas, and Wyoming.
Yay!
Did it. And then everywhere else, we could just transfer it for you and ship it to you. So again, thank you so much for supporting us, the only female-founded, doctor-led company in the birth control delivery space. We're really proud about helping our women get birth control, and we're advocates of reproductive rights. Thank you, Dr. Yen.
Thank you, Susana.
Bye.
Bye.
See you next Tuesday.
Hasta la Tuesday.
Hasta la Tuesday.